Tactical Emergency Casualty Care Backpack Orientation and Equipment Demonstration Video. This short video will orient you on the contents of the EMS Tactical Emergency Casualty Care, or TECC backpack that is located on all frontline fire suppression apparatus and EMS transport units. The TECC backpack was redesigned and updated in 2022. It has 4 pouches inside and contains EMS supplies and a disposable litter mounted on the outside. We will also discuss how to properly use the equipment located in this backpack. The outside of the TECC backpack has a zippered pocket and a pouch mounted onto the backpack. The zippered pocket contains a SAM splint, 2 cravats, and 2 4-inch roll gauze to treat injuries. The pouch contains a litter that can be used to evacuate or extract survivors. The litter is not a drag device. The inside of the TECC backpack has 4 pouches. 3 of them are removable and the 4th is not removable. All 4 pouches contain the same EMS equipment and are meant to be distributed to EMTs and paramedics as needed. There's also a small pouch that contains medical gloves for our clinicians. Each of the inside pouches contains the following EMS equipment: 2 trauma compression bandages, 1 tourniquet, 1 chest seal, 1 4-inch elastic bandage, 1 4-inch roll gauze, 1 6-inch roll gauze, 2 wound packing gauze, 1 emergency survival blanket, and a pair of trauma shears. This check sheet can be found in General Order 2-2, Apparatus and Equipment Checks.
Responder Emergency Trauma Dressing, or ETD. In life-threatening situations, the items in this bleeding control kit are designed to provide you with simple yet essential medical equipment to stop severe bleeding. Open the kit. Remove the instruction booklet and follow as needed. Gloves should be worn during the application. Remove the responder ETD from the kit. Look for the bright red quick tear notches to open the responder ETD package. Open the responder ETD at the end with 2 hands. Place the responder ETD pad over the wound with the other side toward wound label facing up. Wrap the limb. Covering the pad. Pull the responder ETD firmly and continue to wrap the wound completely with vigorous and deliberate tension. Secure the attached Velcro-style fastener when wrapping is complete. Check to make sure no blood is coming out of the top or bottom. Assure the patient that help is on the way.
Hello everyone, my name is Samantha Sonnet and I'm here to show you how to use a tool that can save your life, that can save the life of a loved one or a stranger if need be. And that's the Generation 4 Soft T-Wide Tourniquet. Alright, I've been in law enforcement for the last 17 years in one of the largest police departments in the nation. And during that time I've seen this used in the field quite a few times through all kinds of things, ranging from acts of terrorism to vehicle accidents, to shootings, to stabbings, and construction accidents. Right? This is not just a law enforcement tool though. This is something that every single person can use in their life. I carry one of these when I'm off duty. I carry these in my car, in my bag, and of course when I'm working I carry multiples of these. So what is a tourniquet? This will basically help you if there's some kind of traumatic injury to one of your limbs, your arms or your legs, where you're bleeding heavily and we have to constrict that blood flow within a matter of minutes or seconds. Right? A heavy arterial bleed coming from, say, your arm, for example, you could bleed to death in 20 seconds, really. So knowing how to use a tool like this is imperative. So how does this look? When you first take this out of the packaging, right, the first thing you want to do is make sure that you take this constricting band, because you're going to have a loop here where your limb's going to go through, right? I want to take this and I want to pull it until, for me, a small enough size where I can fit this up my arm comfortably, but I have enough slack in it so if I have like a winter jacket on, it can still fit over it with ease, okay? Now where do I place this? I want to place this high up on my arm, and I want to place it like above my bicep tricep area, but I don't want to go so high that I'm up here on a joint, right? I don't need this on my shoulder cap. It's not going to do anything for me, right? So I get this nice and high. Now once it's here, I clearly need to get the slack out of it, right? So there's a couple different ways that I can go about doing this. My preference is I grab onto the constricting band right here by the clip. I'm gonna move in this direction, and then I'm gonna cinch it down against my body like this. I pull the strap across my chest. Now, sometimes people have a hard time cinching. When they go to do it, they're doing this and it's just not going anywhere. It's not working for them for whatever reason. But that's okay. So now there's something else we can do. If I pin the windlass against a solid object, whether it's a wall, I'm going to use the table in front of me, or say I was laying on the ground, which is a good chance I will be laying on the ground in the real world, I could simply lay my body weight down on top of the windlass to hold it in place. So like I said, I'm going to use the table. So I'm going to lean down and I'm going to put pressure directly in front of the windlass. Right? I want it to be in front of it so that when I take this constricting band and I pull it, that doesn't go anywhere and it allows me to tighten the tourniquet. Now that the slack is out of my tourniquet, the lock back here, right, my anchor point, I can't see it, and that's not ideal because I want to be able to see it. If this is a real life situation and I'm bleeding to death, that's going to be too difficult for me. So what I want to do is I want to grab the tourniquet itself and I want to pull it in towards my chest. Now it's in my workspace and I can see everything, okay? So now here comes the fun part, right? I get to take this windlass and I'm going to turn it. And I'm not just going to turn it one time, right? I'm going to turn it until I really can't turn it anymore. I want to put a lot of pressure on the limb to stop the blood flow. So the best way to do this, as I'm turning it, I don't want to just use my thumb to try to marry these two pieces up, because sometimes you don't have the hand strength to do that, especially if my hand is slicked in blood at this point, right? So what I want to do is I'm going to take the tip of the windlass, I'm going to place it into the palm of my hand, that way it won't slip as easily, and I have the strength of my whole right arm now to go ahead and put pressure on it. So I'm going to put pressure down, I'm going to find that retention clip, and now, and this is a really important part, I need to take this tri-ring and put it over the tip of my windlass as an anchor point, because I don't want this to shift anywhere, right? Now if I'm being rescued, if someone's picking me up or moving me, this thing isn't going anywhere. Okay, so that's a really important part. Don't think that once you just slide this into the retention clip that you're good to go. You have to take that extra step and lock it into place. Okay, now I'm going to show you how to do a leg application. But before I do that, I just want to show you one thing that can happen with the tourniquet. So sometimes you'll get this extra material, since I've put it on a couple times now. All right, this material can sometimes kind of bunch up underneath the windlass here. And I don't want that to happen. I want it to be nice and flush. So all I got to do to correct that is take the band and pull it. And now it sits nice and flush on the tourniquet. And again, that's just part of staging the tourniquet for yourself, okay? So for a leg application, it's great because I have two hands, which makes it a lot easier. And I have the buckle. That's why the Soft T Wide is great, because it actually has a buckle for you to use for the leg application. Makes it much, much easier. So I'm going to go ahead and open the buckle, flip it forward, and remove it. Now from here, I'm going to place this on my leg. Now normally in the real world, I would probably be on the ground, but for the purposes of this video, all right, I'm just going to be standing, okay? Now, as I put this tourniquet on, in the real world, what I'd want to do is find that little shallow space behind my knee. And you want to get it as high as you can on the leg, okay? And then we're going to buckle it into place. Again, this is as high up as I can really go. Now, one thing you really want to make sure of is that you don't have anything in your pockets. The tourniquet is fine going over clothing, even bulky clothing, but there can't be any kind of solid object in between the tourniquet and your limb. All right, so my cell phone's out of my pocket, my keys are out of my pocket, all of those things. And that's true for your leg and for your arm. If you have any pockets up on your shirt, on the sleeve, you got it, those have to be empty, okay? So now I have it nice and high, and I got two hands to work with, which makes this a lot easier. I hold the tourniquet with one hand, and then I'm gonna take the band, and I'm gonna tighten it down to get all the slack out of it. Now from here, I got, again, two hands to work with my windlass. So I'm gonna turn. For the leg application, I usually find it takes a couple more turns than you would see with the arm, but I'm going to turn it until I can't turn it anymore. And then I'm going to go ahead and use the tri-ring to anchor it down. For this, you don't necessarily need to use the retention clip because I have two hands and it's a little easier, but if you need to use it there, that's fine. As long as you anchor it in the end, we're good to go.
In the post-9/11 environment, police, fire, and EMS and all first responders are finding themselves exposed to the same threat that the military sees daily, and that's the threat of penetrating gunshot injuries and blasts, particularly to the chest. The most effective way to treat penetrating chest injury is by sealing the chest off, and the most effective tool out there available to us is the Halo Chest Seal. The chest seal has been an evolutionary process, and one of the biggest problems has been with getting a seal that is effective in any environment. And the Halo Chest Seal has established itself as one that's going to stick no matter what, and that's what a critical component is. In addition, the Halo Chest Seal comes with two chest seals to cover both the front and the back of the patient. We'd now like to demonstrate the Halo Chest Seal.
As you approach a patient that has an obvious penetrating chest injury, if possible, take some 4x4 gauze to wipe around the area affected. If you don't have 4x4 gauze, it's no problem because the dressing will adhere without any problem at all. Remove the Halo dressing from its packaging. It comes with 2 in each package to ensure that you have enough for an entrance wound and potentially an exit wound as well. Remove it from its packaging. You're going to apply direct pressure directly over the site to ensure that you have a completely occlusive seal. During your ongoing assessment of the patient, if the patient develops a tension pneumothorax, the Halo seal comes with an easy pull tab that you can simply just pull back the dressing to burp the wound and can easily be reapplied by simply just applying that direct pressure to create that occlusive seal. Once we've completed the application of the initial Halo dressing, we're going to check the back to make sure that there is no exit wound. And for this, we'll remove the second Halo seal from its packaging if there is indeed an exit wound, and we'll apply it in the same steps that we did, taking care of the initial entrance wound with the Halo dressing. And at this point, we're going to continue to monitor the patient to make sure that there is no development of a tension pneumothorax. For larger exit wounds or larger traumatic injuries to the chest, larger than the initial Halo seal, you can apply a Halo XL dressing, which is 40% larger and has twice the adhesion. And you would apply it in the same manner that you would your initial Halo dressing.
Halo chest seals are utilized to cover penetrating chest wounds such as gunshot entrance and exit wounds. Halo also prevents the air from escaping or entering the thoracic cavity. The Halo seal can also be used to cover and keep other gauze bandages in place. The Halo was designed to work on patients with heavy perspiration or in very wet environments. The highly aggressive tack adhesive of the hydrogel will enable the dressing to conform and hold to the patient's body. In summary, the Halo chest seal is the essential choice for managing penetrating chest trauma. It is ideal for the treatment of open pneumothorax and also to prevent the development of a tension pneumothorax resulting from gunshots, stab wounds, or other penetrating chest injuries. So when dealing with penetrating chest wounds and when time is critical, the first step to saving a life is to use the Halo chest seal.
The H&H compressed gauze can be used to pack a wound and slow severe hemorrhaging. Always wear protective gear such as gloves before packing a wound. Before inspecting the wound, get out the gauze or packing material you will be using. Pull 6 to 8 inches of gauze from the roll. Hold the roll of gauze in one hand and the end of the gauze in the other. Form the end of the gauze into a small ball to form the initial pack. Then probe the wound gently with a finger to ensure there is no shrapnel and, if possible, find the source of bleeding and apply pressure. Once pressure is applied, do not remove your finger. Using your other hand, feed the initial pack into the wound and push it down until you reach the end of the wound. Continue feeding the gauze 2 to 3 inches at a time into the wound. Keep pushing gauze firmly into the wound to apply pressure. Once the wound is completely packed, place the remainder of the gauze roll on top of the wound and apply firm pressure. Keep in mind that it may be necessary to use additional gauze if the wound is large. Hold pressure for 10 minutes, then inspect the wound to make sure bleeding has slowed. Never remove the gauze to inspect the wound. Apply a compression bandage to keep the gauze in place. Tear open the H-bandage package and remove the product, holding it by the elastic to ensure the large pad remains sterile. Apply the bandage with the large pad down over the wound and the H-cleat side up. Center the H-cleat over the wound. Pull the elastic strap around the bandage, securing the short elastic end to the wrap. This will hold the bandage in place when you apply pressure. Then tuck it under the H-cleat and pull down to add pressure on the wound. Pull the elastic wrap under the bandage and wrap it around the other end of the H-cleat to secure it. Wrap the remaining elastic around the entire bandage pad, keeping it tight as you continue to apply pressure. When you have finished wrapping all of the elastic, secure the end of the wrap with the barrette. Always follow your department's protocols and procedures.
The SAM splint, or structural aluminum malleable splint, is a compact, lightweight, and highly versatile device designed for mobilizing bone and soft tissue injuries in emergency settings. Typical uses include splinting of arms or legs of an injured person. Here are a few pictures of the different types of splints that can be made from the SAM splint. The emergency survival blanket is made of mylar and is proven to keep patients warm in a cold situation. The last critical phase of the March treatment algorithm. Patients who have lost a significant amount of blood can also be suffering from hypothermia. Hypothermia is the third most serious condition in a trauma patient. Keeping their body temperature above 89.6 degrees is critical. The litter is used for evacuating or extracting survivors during an incident. It can be used to carry a survivor by 3 or 4 rescuers. This is an example of a 3-person lift with the litter. If you feed the first handle through the second handle, you can create a pocket to prevent the survivor from sliding out of the litter. Do the same with the 5th and 6th handle. For the feet, feed the 4th through the 8th. This is an example of a 4-person lift with a litter. Each person grabs 2 handles on their side to lift the survivor. If you have any questions about the EMS TECC backpack or its contents, please reach out to either the EMS Logistics Office or the Training and Leadership Academy.